It's Monday, January 4. This is the news on PBCJ. I'm Carol Francis. On Saturday, January 2, the island recorded 180 new COVID-19 cases. This is the highest case number seen in 8 weeks. Health and Wellness Minister Dr. Christopher Tufton says this is cause for concern.
This is a positivity rate of 23%, and it represents the highest positivity rate over the past 8 weeks. And of course, this is very concerning to us. You will recall that based on the assessment of public health and as a result of the increased movement in the population due to international travel and the celebrations for the Yuletide season, there is an anticipation, as we had said, of a spike in the number of cases for the month of January. While it is early days yet, the trends are showing an uptick in the number of cases being reported, especially, and this is something we said just prior to Christmas, but especially in the western end of the island.
Chief Medical Officer Dr. Pbcj Mackenzie gave a breakdown on the uptick in cases.
Starting at the end of November, we would have started to go up in terms of the number of cases. Right now, for the period between the 20th of December to now, we are seeing a slight decrease in the number of cases. However, this is very, very early to say that there is any kind of decrease there, because even when we add today's numbers onto this slide, which was as of the 1st of January, we would start to see an increase again in the number of cases. So that decrease there now, we have to watch that very carefully because that will change. Particularly in our western parishes, as we had mentioned, on the left side of the screen, we can see that Westmoreland, our peak is still rising on that side of the island. And we can also see in Hanover that we have an increased number of cases. Essentially, it looks busier on the right-hand side of the graph.
And as we continue to monitor the COVID-19 pandemic on our shores, we get the latest clinical management summary from the health authorities.
154 new COVID-19 cases were reported for Sunday, January 3, 2021. This brings the overall case count to 13,203. Of this number, 1,766 are active cases. The death toll remains at 304. In the parish breakdown, Westmoreland reported 28 cases, while Kingston and St. Andrew and Manchester reported 24 positives. There were 21 in St. Catherine, 17 in St. James, 12 in Clarendon, and 7 in Trelawney. There are 6 cases in both St. Anne and St. Elizabeth, 5 in Hanover, 2 in St. Mary, and 1 case for the eastern parishes of Portland and St. Thomas. 140 recoveries were reported, pushing that total to 10,973. 84 persons are now in hospital, 10 are showing moderate symptoms, and 8 are critical. For the news on PBCJ, I'm Gabrielle Thompson.
Last year, the government announced that the COVID-19 vaccines will be made available locally in April. The vaccine is to be administered initially to 1% of the population. Chief Medical Officer Dr. Pbcj Mackenzie says that percentage has now increased. More from Melvin Pennant.
The CMO was speaking at a virtual press conference last Saturday.
What we have heard that by the second quarter of the calendar year, that we would be receiving the first set of vaccines under the COVAX facility. And this has increased. Initially, it was 1% that we would receive in the second quarter, but this has now increased to 5%. And what you would find is that as more vaccines are approved, more manufacturing occurs, that the numbers may change. But overall, through the COVAX facility, through this first phase, and I just want to reemphasize that this is a first phase, that 16% of the population will be vaccinated. We expect that within the second quarter of 2021 is when we will receive the first set of those vaccines.
Prime Minister Andrew Holness used part of his New Year's message to address the distribution of vaccines.
Vaccines are now available, and our government has set up a committee to plan and operationalize the distribution logistics involved. Jamaica has had a long and successful history in administering national vaccination programs through our primary healthcare system. I certainly recall my time receiving vaccines in primary school. The government will engage in a public education campaign and strongly recommend and urge Jamaicans, particularly those who are vulnerable, to get vaccinated. The vaccine will be free of cost to those who seek to obtain it through the public health system.
Jamaica is among the Caribbean Community CARICOM member states on whose behalf a down payment has been made by the Caribbean Public Health Agency, CARPA, for equitable access to a safe and effective COVID-19 vaccine. Melvin Pennant, PBCJ News.
Health and Wellness Minister Dr. Christopher Tufton has addressed the issue of the recently announced extension of the UK travel ban to January 31, 2021. The travel ban was imposed in response to the spread of a variant strain of coronavirus disease, COVID-19, in the United Kingdom.
Based on this evaluation and in consultation with the Prime Minister, who I spoke to at length today, and the Cabinet, or members of the Cabinet, an extension of the travel restriction has been issued, as was announced, to January 31st, 2021. This is, of course, read the UK. This is in an effort to provide the public health with an opportunity to gather more information on the implications of this new strain, as well as to assess the country's capacity to treat with the challenges that may arise. So we are monitoring, we are learning as we go along. To date, the evidence is not so damning that one should feel more threatened, except, of course, that it spreads more rapidly. And we will have to continue to learn as we go along, because, as we have said, this is a novel virus. It's new.
Wednesday, January 6, 2021, will be the first time in 283 years that the Accompong Maroon celebration in Jamaica will not be physically enjoyed by both Maroons and visitors. The Accompong Maroon Festival is a cultural celebration that commemorates over 283 years since the signing of the peace treaty between the Maroons and the British. This year's celebration will be held virtually, beginning with the ritual proceedings at 10 a.m., followed by a civic ceremony. Local Maroon celebrations will be limited to prescribed numbers in and around the community, and all COVID-19 protocols will be strictly observed. A documentary on the history of the Maroons and these celebrations on January 6, 2021 will be shown right here on PBCJ and all its social media platforms. Jamaica's coffee industry is one of the country's most important subsectors. It generates approximately $25 million annually. COVID-19 dealt the industry a big blow and resulted in a severe fallout in earnings. Chairman of the Jamaica Coffee Exporters Association, Norman Grant, says the celebration of Jamaica Blue Mountain Coffee Day in Jamaica and Japan is part of an initiative to increase production and productivity of Jamaica's coffee farmers. It's also a means of expanding and diversifying Jamaica's coffee industry. Marlon Samuels has more on the impact of COVID-19 on Jamaica's coffee industry and plans to revive the sector.
The rich dark liquid made from Jamaica's premium Blue Mountain coffee is regarded as one of the best in the world. In Jamaica, thousands of families depend on coffee for their livelihood, from planting, transporting and sale of coffee and its byproducts.
The Jamaica Coffee Exporters Association, JAMPRO and JACRO, this year partners with our 5,000 coffee farmers and our 102,000 farm families to celebrate the 3rd anniversary of the Jamaica Blue Mountain Coffee Day, first conceptualized by the importers of Jamaican Blue Mountain coffee in Japan, the AGIJC. 3 years ago, the association in Japan went to their parliament to recognize the 9th of January annually as Jamaica Blue Mountain Coffee Day. We approached the Jamaica Coffee Exporters Association, approached our Governor General to sign a proclamation that in Jamaica we will also celebrate the 9th of January as Jamaica Blue Mountain Coffee Day. This is against the background that Jamaica Blue Mountain coffee is very important to the agriculture sector that contributes 6% to GDP, to our development as a nation, as the coffee sector touches the lives of 5,000 coffee farmers and 102,000 farm families.
Coffee is one of the most highly traded commodities in the world. 70% of Jamaica's coffee is sold to the Japanese market. An additional 20% is sold to the United States of America. The remaining 10% is sold in Europe and across the rest of the world. The outbreak of COVID-19 across the world resulted in a significant disruption in the international coffee supply trade. Jamaica saw a 50% decline in sales in the first 3 months of the coronavirus pandemic.
During the shutdown, over 50% of our coffee could not be sold. In fact, it is argued that during the first 3 months of the shutdown, we lost value-added sales in the local market up to 90%. As a result, in the local trade, we had some 750,000 pounds of coffee unsold, valuing close to 1 billion Jamaican dollars. The price of coffee also was significantly reduced due to the overstocking of coffee in the international market.
Despite the challenges, the long-term future for Jamaica's coffee industry remains positive. There are a number of initiatives being planned to ensure the revival and growth of the industry, including the Jamaica Blue Mountain Coffee Day on January 9, 2021. A church service was held on Sunday to kick off a week of activities.
The week will continue with a number of other events. There will be a virtual conference that will be staged and organized by the Consular General in New York. Our Ambassador Shauna K. Richards will be working with our partners in Japan who will celebrate Jamaica Blue Mountain Coffee Day on the 9th of January by doing a lot of promotional events. There will be promotional activities throughout the week at most of our missions: Miami, London, Toronto, Tokyo, New York, and Boston. And we want to really thank JAMPRO for the role that they continue to play in the celebration of Jamaica Blue Mountain Coffee Day. Other activities will include coffee crawl, discounts on Jamaica Blue Mountain Coffee Day at our coffee shops. There will be tasting in our supermarkets, and there will be a number of other events that will be staged by the membership of the Jamaica Coffee Exporters Association.
There are also plans to infuse a coffee drinking culture in Jamaica to not only expand sales but to bring about a greater level of connectivity among Jamaicans.
Statistics shows, based on a survey that has just been completed by JACRA, that our coffee consumptions in Jamaica is 0.25 kilograms per person per year. While in other coffee growing countries, you're talking about 4 kilograms of coffee per person per year. And therefore, with the issues that we have as it relates to our over inventory, we will be promoting our coffee to our citizens as well as tourists. So there is a significant uptake that we can realize by drinking coffee more coffee as a hot beverage in Jamaica. It's going to be a long haul, but we're going to start that campaign similar to the Eat What We Grow, Grow What We Eat campaign that I launched when I was president of the Jamaica Agricultural Society. We are now going to engage our Jamaicans into drinking coffee as a hot beverage.
Brewing a coffee culture could well be the recipe for a significant growth in the coffee sector. For the news on PBCJ, I am Marlon Samuels.
The island's construction subsector grew by 7% and agriculture, forestry and fisheries by 2.5% during the July to September 2020 quarter. That's according to the Statistical Institute of Jamaica, Statin. These figures are within range of the estimates put forward by the Planning Institute of Jamaica, the Pbcj. According to data from Statin, these were the only subsectors recording growth in the goods-producing industry, which declined by 3.5%. The other two subsectors, mining and quarrying and manufacturing, contracted by 20.7% and 10.9% respectively. Global oil prices have gone up as more nations begin the new year with COVID-19 vaccine rollout campaigns. In today's business report, Gabriel Thompson fills us in on this and other key market details.
In Thursday's trading session, the JSE Combined Index advanced by 1,821 points to close at under 400,000 units. Overall market activity resulted from trading in 91 stocks, of which 39 advanced, 40 declined, and 12 traded firm. The Junior Market Index declined by 3 points to close at under 3,000 units. Stocks advanced for Berger Paints Jamaica, CAC 2000 Limited, and Cargo Handlers Limited. Stocks declined for 138 Student Living Jamaica, 1834 Investments Limited, and Access Financial Services Limited. Trading firm were CAC 2000 Preference Shares, Siboney Group Limited, and Dermont Trading Company Limited. Trans-Jamaican Highway Limited was the volume leader with 10.1 million units, followed by Panjam Investments Limited with over 10 million units, and Pulse Investments Limited with 6.6 million units. Now for the foreign exchange. The US dollar on Thursday, December 31, ended trading at $142.64. The Canadian dollar sold for an average $111.41. The pound sterling traded for $193.66, and the euro ended trading at $176.82. Oil prices touched multi-month highs on Monday on expectations OPEC and allied producers may cap output at current levels in February, and on hopes that coronavirus vaccines may help curb the spread of the virus and help drive a strong economic rebound in the new year. Brent crude futures added 61 cents at $52.41 a barrel. West Texas Intermediate crude futures gained 35 cents at $48.87 a barrel. And that does it for this edition of the Business Report on PBCJ. I'm Gabrielle Thompson.
In regional news, Prime Minister of Antigua and Barbuda, Gaston Brown, has assured the Mia Mottley-led administration that he will not be prohibiting travel to and from Barbados as the nation grapples with a surge in the number of COVID-19 cases. In a letter to his Barbadian counterpart, Mr. Brown said he was deeply troubled to learn of recent events in Barbados that caused a surge in the number of COVID-19 cases there. Mr. Brown's letter comes in the aftermath of concern expressed in November after Barbados placed Antigua and Barbuda on a list of countries deemed medium risk for COVID-19. It was argued then that the position taken by Barbados was unacceptable based on Antigua's COVID-19 figures. St. Lucia's coronavirus case tally has moved to 340. 3 children and 1 senior citizen are among the latest nationals to contract the virus.
The Ministry of Health, in a press release on Wednesday, December 30th, 2020, confirmed 9 new cases of COVID-19 out of a batch of 217 COVID-19 tests conducted at the Ezra Long Laboratory. According to the Health Ministry, this brings the total number of cases diagnosed in country to date to 340. All 9 cases are St. Lucian nationals. Case number 332 is a 7-year-old female from the Castries district. Case number 333 is a 38-year-old male from the Castries district. Case number 334 is a 4-year-old female from the Castries district. Case number 335 is a 31-year-old male from the Grosley district. Case number 336 is a 16-year-old male from the Castries district. Case number 337 is a 22-year-old female from the Castries district. Case number 338 is a 49-year-old male from the Ancillary district. Case number 339 is a 48-year-old female from the Dennery district. And case number 340 is an 84-year-old female from the Castries district. The Ministry of Health says 5 of these cases are contacts of previously confirmed COVID-19 cases. All of these individuals, according to the press statement, have been tested for COVID-19 and placed in quarantine by healthcare practitioners pending receipt of their results. Investigations are currently being undertaken to determine the possible existence of an epidemiological link for the other 4 cases. The Ministry of Health says, as per protocol, arrangements have been made for the placement of all these individuals into isolation. The Health Department on Wednesday also reported a total of 4 recoveries. This brings the total number of active cases currently in country to 62. As St. Lucia prepares to bring the year 2020 to a close and usher in a new year, the Ministry of Health in the dispatch expressed appreciation to citizens of St. Lucia and the effort over the course of this year to reduce the impact of COVID-19. Public health authorities once again appealed to the public to adhere to the COVID-19 prevention and control measures to minimize the spread of the virus. Colby DeVoe, HDS News Force.
Trinidad and Tobago is pursuing 2 methods to secure COVID-19 vaccines for the population by March 2021. We have more from Terry Ann Brown Campbell.
Health Minister Terence D'Alsing, speaking at the San Fernando Teaching Hospital, indicated that the World Health Organization's vaccines for this part of the world is the COVAX trials. He outlined the process that government was taking to ensure that this country would have access to approved vaccines.
Trinidad and Tobago is pursuing the procurement of vaccines via 2 mechanisms. 1, COVAX, and 2, out of COVAX. We are pursuing talks with Pfizer, AstraZeneca, and the government of the People's Republic of China.
The minister indicated that while some of the population was eager for this country to get our vaccines as quickly as possible, he noted that this was not the safest course of action.
By March, the world community, which is currently vaccinating people by the hundreds of thousands, it means we will have a lot more what is called endpoint data. We will have a lot more safety data. We will have a lot more efficacy data. We will have a lot more data on the use of vaccines in what we call special populations or complex populations.
The minister also noted that this country was one of the safest places to be if you are concerned about contracting the virus.
The case fatality ratio is the number of persons who have died divided by the number of positive tests, individual positive tests you have in a country. That's how you calculate your case fatality ratio. The global average of case fatality ratio is in the region of 3%. Trinidad and Tobago's case fatality ratio is 1.77.
This country stands with New Zealand and Vietnam as having one of the lowest global averages of COVID-19 deaths. Terry Ann Brown Campbell, TTT News.
Over in the Bahamas, the assertion by the island's health minister that increased restrictions will depend on whether Bahamians have been naughty or nice is not sitting well with the opposition leader, who says citizens are not children. We have more in this report.
If they are nice, we're not talking to children.
Opposition leader Philip Davis is again lashing out at the minister's administration, which he accused of pointing the finger at the Bahamian people. He was responding to Health Minister Renwood Wells, who on Tuesday told reporters that government will know in roughly 2 weeks if more COVID-19 restrictions are necessary. He added this will be heavily dependent on whether Bahamians have been naughty or nice over the holidays.
It is typical of this government to continue to point fingers. Why point fingers at the populace? They are not children that have to be nice. What is required of this government is to ensure that they have the proper protocols in place to protect our citizens from the transmission of the virus.
While admitting that Bahamians do have a part to play in slowing the spread of COVID-19, Davis said the problem is the government's approach to the pandemic.
The challenge they have is that the government's approach to the pandemic is to coerce Bahamians into certain kind of behavior, when in fact they should be seeking the cooperation of the Bahamians. So it is cooperation over coercion. And that is what we seek to see the government attempting to do.
In recent weeks, the Bahamas has seen a decrease in COVID-19 cases. This prompted the Prime Minister to relax a number of restrictions ahead of the holidays. The opposition leader added that the key to getting the public's cooperation is through public education. It's an area, he said, the government has failed in.
And I think they're falling down on educating the public about this virus and how best to deal with it. And that is lamentable on the part of this government, that they would continue to point fingers at the populace.
Reporting for Our News, I'm Berthany McDermott.
In sports, we are in the creases with cricket. The West Indies Players Association, WIPA, has thrown its full support behind the COVID-19 health protocols implemented for the upcoming Windies tour of Bangladesh. Secretary Wayne Lewis says WIPA held extensive discussions with Cricket West Indies and are convinced the protocols are consistent with what has been executed on previous tours. In the meantime, 10 first-choice players last week declined selection for the Bangladesh tour, which comprises 3 one-day internationals and 2 tests. COVID-19 related concerns or personal affairs were cited as the reasons behind their absence. Test skipper Jason Holder and white ball captain Karen Pollard, Darren Bravo, Shamar Brooks, Roston Chase, Sheldon Cottrell, Evan Lewis, Shani Hope, Shimron Hetmeyer and Nicholas Puran all opted out of the touring party. And that's our package. Join us again tomorrow, same time, same place, for more news and sports right here on PBCJ, the People's Station.